Hi, welcome back to my channel. In this video, we'll go through anti-malarial drugs. So, first of all, you should know about the basically the life cycle of, as to how the basic those phases occur, and so then how we inhibit them and so on. So, first of all, let's just understand the simple thing. So, first of all, suppose this is our man and this is our mosquito. So, what happens is the mosquito, he has a sporozoid form. So, yeah, so we have sporozoid. Now the sporozoid enters into the man. Okay, now the sporozoid, it goes into the sorry, it goes into the liver. Okay, yeah, I'll make a better one. Suppose this is our liver. So here it gets converted into merozoid. Now this merozoid has two forms. One is the macrozoid and one is the micromerozoid. Okay, so merozoid. Now this merozoid, it basically goes back to the liver again, and this phase is called as exoerythrocytic schizogony. Okay, and this phase is known as pre-erythrocytic schizogony. Then this micromerozoid, it goes into the RBC. Now here it's basically converted into trophozoid, which is converted into schizont, immature, then mature, then merozoid, and then it is converted into gametocyte, and this gametocyte is picked up by the mosquito again, and the cycle continues. So this phase is in the RBC, it's called as erythrocytic schizogony. Okay, so now let's just so these are the phases. Now let's just go through each phase and how. Basically, first of all, you should know the infective form. So infective form in man is sporozoid, and in mosquito, which is the Anopheles mosquito, is gametocyte. Okay, now basically we'll just block all the schizogony phases. So first phase that we can block is the pre-erythrocytic schizogony. Now this is inhibited by three drugs. So first of all, what we call this inhibition is as casual prophylaxis. So you have to remember three P's. Okay, so you have proguanil, pyrimethamine, and you have primaquine. Okay, then second phase is you can block is erythrocytic schizogony. Now this one was occurring in the RBC, remember. So this is called as suppressive prophylaxis or clinical cure. Clinical cure. Now for this you have to remember QMAC. So you have quinine, mepacrine, then we have artemisinin derivatives, then we have chloroquine. Then we can block the exoerythrocytic schizogony. Now what was this one was basically the one which didn't go to the RBC and went to liver back. So this is basically always responsible for relapse cases. Now to inhibit this, we need first of all, what we call this is radical cure. Okay, basically we're terminating the organism and we are not letting the infection happen. That is what is called as radical cure, and this is done by primaquine. Okay, then the next stage that we can inhibit is the gametocyte. So gametocyte. Now this is the prevention of transmission phase. Transmission phase. So this is different for different drug. So different for different mosquito species. For plasmodium species, so for P. falciparum and vivax, so they're different. So we'll just first talk about falciparum. Sorry. So for falciparum, so you have to give the three P's, and for vivax you have to give chloroquine, mepacrine, and quinine. And if you have to inhibit both, then you give three P's and artemisinin derivatives. Okay. Now there's one thing. This exoerythrocytic schizogony that I told about relapse cases, it is absent in P. falciparum. Okay, and now let's just talk about the chemoprophylaxis of malaria. So I'll just write it here. Is yellow visible? Yeah. So chemoprophylaxis of malaria. Now in chemoprophylaxis of malaria, basically you have to know that we can give two drugs. One is the doxycycline and one is the mefloquine. Now this doxycycline is for short term, which is less than 6 weeks, and mefloquine is for more than 6 weeks, so it's basically long term. Now doxycycline, it is started 2 days before travel. They asked this question, and it's continued for 4 weeks after leaving endemic area. And long-term mefloquine in this basically 2 weeks before travel and 4 weeks after leaving endemic area. Now this point you need to know, this is contraindicated in neuropsychiatric patients or patients with previous history of seizures. Now doxycycline is contraindicated in pregnancy and children below 8 years. Okay, so this covers most of the things that we need to know. Yeah, sometimes basically when you talk about erythrocytic schizophrenia and all these drugs, so sometimes they ask what are the fast acting and the slow acting. So all the P's are the slow acting ones and these all are fast acting. Okay, so these are fast acting. So this covers most of the malarial drugs. So we'll just go through the picture if we can find. And to recap, anti-malarial drugs. So this seems better. Okay, let's just go through this one. So as I told you, female Anopheles mosquito responsible for malaria, right? And now first of all, we have sporozoites. They go into liver. So we have sporozoites and they go into liver, converted into merozoites. So this is our pre-erythrocytic schizophrenia. Then this goes into the RBC. Now this is erythrocytic schizophrenia, and if it goes back to the thing, then liver, then it's exoerythrocytic schizophrenia. Then this is the gametocyte phase that we block. Okay, so I told you first is pre-erythrocytic, so you have basically 3 P's, right? Then exoerythrocytic, the one that causes relapse. Okay, then erythrocytic schizophrenia, most important, chloroquine, mepacrine, quinine and all. Then gametocyte, primaquine. Okay, so this covers most of the malarial drugs. So if you found this video helpful, do give it a like, share, subscribe. Thanks for watching.